Good evening, everyone. I'm Dr. Archana V from Medman, and welcome all of you to this session, free orientation session on Pdosmr. I hope the slide is visible for all of you. So, once again, good evening. Welcome to our session, Professional Diploma in Sports Medicine and Rehabilitation, Pdosmr. And this is organized by Ayurveda Map and initiated by MedMap. So I'll just brief about this course to all of you. In this course, you will learn hospital level spine, joint, and sports injury management with physical medicine integration in a period of 6 months. This is an NSDC certified diploma course and it is ATAB RAV approved certificate fellowship course. So there will be 4 sessions per month, including both live classes and recordings with doubt clearing sessions. And there will be around 30 offline sessions. Now, of these 17 days practical training, this will be mandatory for all of you. And there will be 15 days OP practice, and which can be extended if you require additional practice. So, all the full hospital based training, exams, and practicals will be held at Dice Hospital, Kondoti. So in addition, we have another program that is Sandhana. So those who are joining for the PDOSMR course, you will gain access to Sandhana. It's an integrative approach to sports medicine. So as I mentioned, it's an additional course. So this will be complimentary for you if you are joining a PDOSMR course, or you can also join this individually again. So in PDOSMR, what you are going to learn is the orthopedic assessment, the joint disorders, disc pathologies, clinical evaluation protocols, the radiological interpretation, the X-ray, CT, MRI reports for fractures, dislocation, and the soft tissue injuries. You'll also learn the Panchakarma and Marma Chikitsa and sports medicine, and so on. So to access these classes, you can either log in to your mobile app. So you'll have the Ayurveda Map app, which is available in the Android Play Store. And you can download this, enter your registered email and enter the password, and you can access the class in the library section. Or you can also use the Ayurveda Map website, and if you're using the PC or iOS, you can log in through that. Again, click on the My Course session and you can access the class there. So in case you're having an iPhone, you can, the other alternative is to use a Google Chrome via the iPhone. So you can open the Ayurveda map site there and there will be a 3 dots available in the bottom right corner. You can add it to the home screen and tap add and you can view the class anytime on the home screen. So an important point to note here is there are 2 sessions here, like the live sessions and the recorded sessions. So the live sessions, you will find it available under the Professional Diploma in Orthopedic and Sports Medicine Rehabilitation in Ayurveda, the live, and the recordings will be in the recording session. So I have kept the pictures there, so there won't be any confusion there, like which is a live session and which is a recording when you're going to access the classes. So the importance of attending live session, I understand like all of you are busy, but when you attend the live session, you will get a real time interactions. So there will be a doubt clearing session with the faculty. You can, of course, you will have to access all the recordings earlier, so you can make notes on the recordings and you can clear all your doubts to the expert faculty there. And this will also help in a structured learning because you can stay on track. So this is a 6 months course, so there are chances like you can get deviated. So by attending these live sessions, you can stay on track. And another importance is peer networking. Of course, you are going to join a course where there are other doctors, BMS doctors there, and you can participate in interactive sessions with all of them. So that's all. These are the course details and enrollment contact details available. So if you have any doubts, you can unmute and ask me now. Thank you, everyone.
Yes, good evening, Dr. Shah.
Good evening.
Thank you for the introduction. Yes, actually, this course is for the orthopedics and sports medicine enthusiasts who like to develop their career in the Ayurveda orthopedics and sports medicine. Basically, the orthopedics are well flourished in Ayurveda, and getting into the orthopedics means somewhat a difficult thing because we need a thorough training, and it takes years to become a good Ayurveda orthopedician. That's true, actually, because we need a constant hands-on training, and we need to see more patients. Yeah, definitely. And so this is like a bypass in which we will be teaching you the orthopedics and the sports medicine techniques, which basically the doctors are practicing hands-on sessions, and you will have the exposure to the patients in these 30 days. Okay. So you will have an initial confidence to practice as an orthopedician. After that, you can easily develop your orthopedics practice. In this 15 days, we will be going to the bandaging sessions, like joint by joint. We'll be teaching you how to do bandages, how to integrate the physiotherapy. That is the important part. That is the exclusive part. You may not be having getting from anyone. The physiotherapy part, the rehabilitation part, rehabilitation, that is ortho rehabilitation part. That is our exclusive thing that you may be uh, get studied in this course, and definitely the Ayurveda management part. So, like Ayurveda management and the physiotherapy management means through the physiotherapy management, we can get the results very easier. So these therapies we can use in the sports medicine, combining with the sports therapeutics. We can we can give that treatments to the sports people also. Okay. And definitely it is much helpful for the normal people as well as sports people, because sports people need immediate result and immediate recovery, or like uh, mm, very faster relief than a normal man, because they need to go they need to go to this again, have to practice, or go to their definitive parts. So, so we have our partner, Daisman Ayurveda Sports Medicine Center at Kondoti. The hospital is around 15 years of experience in this field, and that is the number one orthopedic and sports medicine center in Kerala. So that is a great opportunity for you to have a hands-on session there. Okay. And definitely this Sandhana session, you can just enroll Sandhana session if you are still confused about where to go, like if is sports medicine or orthopedics is my career, or you if you have similar doubts, you can join the Sandhana session, and you can just by watching the videos. mm, you may be knowing that yes, this thing I can do, or orthopedics is very suitable for me. Then you can definitely join this full course in which you may be getting the this offline trainings. And what actually we are doing, like we already completed 3 batches. and the results and the feedbacks are very excellent. So this is your next opportunity to enroll in this course. These seats are very limited, and we already have 70% occupancy right now in this batch. So some even though seats are available right now, you can join in this course, and yeah, definitely. So I want to know how many of you are already joined. Just send, just put a me in the chat box. Me in the chat box. Those who already joined this course. No? Just put a me in the chat box and me. So they have to study the basic things like the anatomy is the basic thing. As I'm mentioning right now, the anatomy part is a basic thing. You just go to your anatomy books and start now itself studying the anatomy things, because anatomy is very important. You have to reach in the level of that that what we studied in the first year anatomy, like the muscle, what are the muscles in the anterior part, their origin, insertion, nerve supply, blood supply. Yeah, definitely. These things you should have a clear idea. Then it will be very easy for you to study all these things, because we have the trigger release methods, like different methods we will be adopting, and even the stretching exercises, everything will be depend upon the anatomic side. So you should have a clear idea about the superficial muscles, deep muscles, where we have to palpate. Then it will be very easy for you in the orthopedics that a normal doctor, what I don't compare merely, just an example, like a normal doctor uh, means I inspect in a general way, but like a specific ortho doctor will have to palpate the muscle level. Okay. So if you want to specialize in ortho and sports medicine, you should have a clear idea regarding where to palpate the specific muscle, specific bone, like you should have a clear idea regarding the palpation. Hmm. So start collecting your anatomy books, and start reading, and start uh, going again, review the important things in your anatomic side. Dr. C.K. Mohammed Zidan, Dr. Aniket Kot, and Dr. Susmita Jaykumar already joined. Okay, very good, doctors. So, and also this in this batch, what actually we did is like we have the recording sessions and the live sessions. So the recording sessions are the theory sessions. So you can go through that, and we have the live sessions with the faculties, so that you can go through the live the recordings, and you can come to the live sessions for the discussion part, so that it will be very easy for you to interact. So those who joined, we already given you the access to the uh, classes, that is the pathology part, the physiology part, and the basic part, etc. And those who didn't get the access, you can contact us. We will be giving you the access, so that you can go through all these recorded videos, so that you will have a clear clarity on the basic parts. Okay. If you are strong in the basic part like anatomy and the pathology part, it is very easy to teach you. Okay. And because at that time, your questions will not be like a simple question, because when we teach you the basic things like anatomy, it takes much time to consume. Hmm? Okay, so in a batch, in the first batches, I can see that those who didn't have an idea, and those who are expert in ideas. So there may be like time consuming if you are still in the basic side. So what I'm requesting you to go through the anatomy part, be thorough in the anatomic side, so that it is very easy for you the to understand the every concepts in the ortho and sportsmen. Okay. So, like when the new batch will start? Yes, 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 doctor. The new batch will start soon, and we will have the practicals. We will let you know the practicals time. The practicals will be together, so that you can come in batches, and we will have the mandatory 17 days and the optional 15 days. We are urging you to attend the total 30 days. Okay, because 17 days, in 17 days there is no patient exposure. Only you will be getting idea about how to do bandages and how to do the stretching exercises, everything, physiotherapy. Means that is your study part. Okay. At that time, you will have the hands-on training sessions on the procedures. And the next 15 days, you will be having the exposure to the patients, and you will be you will have the patients of like rehabilitation patients you may be getting, or fresh cases you may be getting in the OPD part. So yeah, from the initial part itself, you can follow up a patient, or like rehabilitation also you can follow up, so that what you studied or what you got hands-on training, you can directly apply to the patient in the OPD level. So I'm requesting everyone, those who already joined, to plan your 30 days. It may not be continuous. Okay. So 17 days will be a continuous, 15 days it will be continuous. Next 15 days that you can plan. Okay, you can plan and come. You can contact our team, so that they will give you slots. Only one person can sit in the OPD. So we will be allotting you the 15 days according to your requirement, or like if you are free, you can come now itself. Okay, those who are already joined can plan now itself. Our slots are right now are free. So you can plan, or you can just inform when you will be coming, so that we also will arrange your offline things. Okay. And the main 15 days module, that is the practical hands-on training, that will be together. Okay. Hope you all are understand. Do we get hands-on training sessions by January? Yeah, yeah, sure, sure, doctor. Actually, we will be having exam by this October, November time. Okay, October, November time. So we'll be completing that. This is a 6-month course. We'll be completing this by January. Okay, sorry, by November. Okay, so before November, everything will be completed. So, is there any clarification needed? You just ask. I can clarify. So, the center is Daysman Sports Medicine Center, Kondoti, Kerala. Dr. Ashwini, exam will be offline mode. Yes, exam will be in offline mode only. You will have a small practical exam as well as theoretical exam. Okay. How many of you started learning anatomy? Just send me M in the chat box. M and me in the chat box. So those who already started working, like studying anatomy things, those who joined, those students who joined, who started learning, just put the M in the chat box. Nobody? Uh, I thought this meet is for August to January batch. I have okay. So this batch, August to January batch. Okay. Actually, we have this June, November batch. Right now, it's undergoing the June, November batch. After online class and finishing the exams, only 27 days training will start. No, doctor, everything will be going together. You can watch the online sessions and the online session timings will be evening 7:30. Okay. And the offline session timings will be from morning 10:30 to evening 5:30. Okay. Maybe if patients are there, it may go around to 6 or 6:30 or 7. Okay. That depends upon the patients. So evening OPDs are there. So you can stay there for more exposure. After this batch, when you will be planning for next batch, that we will update you, doctor. So what you can do is to complete your practicals because we will be having the practicals maybe on this October. So you can plan for the practicals. Do contact our team. Okay, our team will guide you. Um, just put a hi in this number. I will guide you. This is my number. I will guide you. Just put a hi in this number. We will guide you. Uh, and one more thing. Those who are already joined, we have given you we have given them a offer. So as you joined in this webinar, a special offer is there for those who didn't join yet. So just send me a message in this number right now itself. Okay, so that I can uh, collect these numbers. Those who wish to join now itself, you can contact in this number so that I can given you a special offer, those that we provided to the previous students. So just send me a hi in this number. So when the hands-on training will start on this month of this batch. So hands-on training dates are not yet confirmed. Uh, because maybe it will be in September or October. Okay, maybe we have two batches that we are right now we are on this um, planning. So maybe in September, October we will have the hands-on training batches. Okay, that we will inform you when will be the hands-on training batches will be there. That we will inform you. So in every batches, right now we will have only fewer students so that they will be getting the hands-on training and other support very easily. We will not make it big or crowded. So we will make it very short. Hi, sir. My friend wants to join this batch. Can they join? Yeah, yeah, sure, doctor. Sure, doctor. If those who joined, I can request that if your friends or similar interested people are there, you can just ask them to join. Okay, because you can come together, and if you are looking for accommodation, you can stay together. You can have your food etc, because you may be veg or non-veg, like different tastes are there. So you can come together. Okay, so that it will be very easy for you, very comfortable for you. The comfortable people will be there, means you will be very comfortable, that you can adopt. So yeah, definitely you can ask your friend to join. That will be very comfortable for you, your side also. Yes, Dr. Aniket. So, may I know from which places you are? Just put your city in the chat box. I want to know from which cities you are. Yes, Dr. Bharati from Coimbatore, Dr. Sampath Kumar from Mangalore. Okay, good. Dr. Adarsh from Kozhikode. Hi, Dr. Adarsh. Dr. C.K. Mohammed Zidan from Malpuram. Hi, Dr. Zidan. Then Dr. Abdul Shogan. Now in UP from Trivandrum. Okay, good. Yes, Dr. Aniket from Belgavi. Good. Yes. Um, Dr. Susmita from Kollam. Okay, good. So, those who already joined, please please introduce yourself and just uh, like what are your expectations? Please let me know so that we can plan, we can serve you better. What are your expectations? You can express in your language, whether it is Malayalam, English, Hindi, or whatever language it is comfortable for us. Just uh, unmute in your own language and just express. Dr. Kiran, presently in Delhi from Guruvayur. Okay. Hi, Dr. Kiran. So those who already joined, just unmute themselves and introduce yourself. So why you joined this course? What are your expectations? Yes, just let me know. So you can express in your language, doctor. No issues. Like Dr. Zidan. Yes, doctors. Dr. Susmita, what about the hands-on training? I can know about the patient flow. As I mentioned, you will have the total 30 days program. In the first hands-on training, 17 days, you will not have patient exposure because that is the intense training program will be happening in which we will be teaching you hands-on sessions will be there like different bandages, physiotherapy, in the stretching exercise, that will be totally uh, teaching time, like hands-on session time. Okay. Then next 15 days, you will be totally in the OPDs, and you can just go through all your hands-on sessions after 15 days in which you can practice or you can do the procedure again. You can repeat that, and also you will be exposed to the patients. So in the Daysman Sports Medicine Center, you can see variety of ortho cases and also fresh cases. That depends upon time. Uh, so normally they will be getting patients, fresh cases as well as the rehabilitation, chronic patients. So patient exposure will be good uh, in the timings. So definitely you can come and uh, you can come and see the patient flow uh, in the timings. Mostly in the evening OPDs. Yes. Dr. Susmita, Dr. Zidan, you can unmute. Dr. Aniket, just let me know what are your expectations. Dr. Adarsh, just let me know. You can express in your languages, like what are you expecting and why you joined this course.
Hi.
Hello, Dr. Adarsh.
So ഞാൻ PNNL പഠിച്ചിട്ടുണ്ടായിരുന്നത്.
Ah,
അപ്പൊ ഞങ്ങക്ക് ഇവിടെ സ്വന്തമായിട്ടൊരു കളരിയൊക്കെ ഉണ്ട്. കുജാറയില് ഹിന്ദുസ്ഥാൻ കളരി ഉണ്ട് കോഴിക്കോട്.
ah,
അവിടെ ഇങ്ങനെ ചെറിയ പ്രാക്ടീസ് ഒക്കെ ഉണ്ട്. ഓർത്തോപീഡിക് സെഷൻ ഒക്കെ കളരി മർമ്മ ചികിത്സാ കാര്യങ്ങളൊക്കെ ഉണ്ട്.
ah,
അപ്പൊ
good.
അതിന്റെ കൂടുതലായിട്ടൊന്ന് ഒന്ന് പഠിക്കാൻ വേണ്ടിയിട്ടാണ് ഞാൻ ഈ ഗ്രൂപ്പിൽ ജോയിൻ ചെയ്തത്.
Good, good, good. ഓക്കെ അപ്പം ഡോക്ടർ ലാൽകൃഷ്ണൻ ഇവിടെ
ആ ആന്റിയുടെ ഹസ്ബൻഡ് ആണ്.
ആണല്ലേ? ഓക്കെ ഓക്കെ ആ ഹാ 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 ഓക്കെ ഓക്കെ അപ്പൊ നിങ്ങൾ എല്ലാവരും ഒരുമിച്ച് ചെയ്യാം. ഓക്കെ ഗുഡ് ഗുഡ് ഗുഡ്. All the best, doctor. So you already know all the things. So it will be like integration, etc. That will be good. So you do POPs, etc.
POP അല്ല, ഞങ്ങളുടെ ബാൻഡേജിങ് സിസ്റ്റം ഡിഫറെന്റ് ആണ്. മെഡിസിൻ യൂസ് ചെയ്യുന്നത് ഡിഫറെന്റ് മെഡിസിൻ ആണ്.
Okay, okay.
ഒരു
Okay.
ബാൻഡേജ് ആണ് അത്, ലൈക്ക് എ പ്ലാസ്റ്റർ ഇറ്റ് സെൽഫ്, ഇറ്റ് വിൽ വർക്ക്.
Okay, okay. So we can also learn from your side. Okay, okay, good. Yes. Thank you. How about expenses like a room and food? Yes. Uh, yeah, room and food. The accommodations you can get from if the hospital is free, you can get the accommodation in the hospital itself, Daysman Hospital itself. And if hospital is crowded, you can get outside accommodations there. Okay. So that depends at the time when you are coming. Okay. So I think it will not take much mm, amount. It will be nominal charges will be there. So you can contact us for more details like accommodation, etc. That we will guide you. Okay. So any other clarifications needed, just put in the chat box. Most probably you may be getting the accommodation in the hospital itself. Last batch students all were there in the hospital itself. If you need, if you are with your family and you need outside accommodations are also there. That depends upon. Okay. And ladies hostels, etc. are also there in the nearby vicinity itself. Uh, you can contact us for this accommodation like things. You can contact us. We can guide you some important accommodation areas. We can guide you. Okay. Is canteen facility available? Yes, the food is available in the hospital canteen. Uh, so if you are staying in the hospital, food is available in the hospital canteen. Breakfast is available. Dr. Mohammed, training will be conducting in Cochin, at Cochin or Calicut. Yes. Okay. So training will be conducting in not in Cochin and Calicut, in Malappuram. Okay. So Kondoti. The training center is Daysman Ayurveda Hospital, Sports Medicine Center, Kondoti. Because as this is a clinical part, uh, we can't arrange it as separate entity. That will be together in a hospital in which you'll be exposed to the physiotherapy equipments, patients, and the bandaging materials, etc. Everything will be together. Everything will be together needed. Mandatory 17 days attendance. Mandatory 15 days is compulsory. Yes, that is mandatory. Hmm. As I mentioned, that is the core part in which we will teach you the hands-on session. Next 17 days is optional for you, in which you will have the classes as well as the clinical exposure, like patient exposure. That will be next 17 days. So mandatory 15 days. That is mandatory for writing exam and getting certificate. And as this is the professional diploma in Ayurveda, this sports medicine. So it needs this mandatory 15 days or like mandatory 17 days. Yes, same. Both are same. Yes, any clarifications needed? So, uh, so this will be one of your life-changing course in which if you are seriously looking into the orthopedics and the sports medicine. Yes, continuous days will be there. Sunday is off actually. Sunday will be off. Okay. Dr. Bharati is asking what level of courses, like in intermediate level or beginner level. Yes, yes, doctor. This is an expert level course, not a beginner level or the intermediate level. This is an expert level course. So that's why we ask you to come with a thorough knowledge of anatomy. Okay. If you are not in get if you don't have much knowledge on this anatomic part, for that persons for that people it may be like a beginner course. But if you are well thorough with anatomy, muscle origin, insertion, superficial muscles, deep muscles, etc. knowledge, it will be like an expert course itself. Definitely. We will teach you what actually everything that is related to the practice. What we are practicing, that we will teach you. Okay. So definitely it will be useful. And also, if you have good knowledge in X-rays, that will be also useful for you. Definitely. So, Dr. Archana, is there any other questions?
I believe no, doctor. Like other questions, the participants have.
Yes, yes.
Yeah, all the questions have been cleared in the chat box.
Yes, yes.
So, doctors, if you have any other questions, you may ask now.
Yes, yes. So I'll put my number again. You can just contact us for the special offer that we given to the already joined students. Okay. Just put a hi in my WhatsApp right now itself. Okay. So definitely we can see on the later sessions. Uh,
Thank you, doctor. I believe the participants they have gained enough knowledge about the PDOSMR session. So, doctors, if you have any other doubts, please contact our team. You can always contact Dr. Jasal also. So, I believe we can conclude this session for now. Thank you, doctors. Thank you, everyone. Have a good night.
Bye-bye.